This week in personal training, I'm going to be bringing you inside the gym to work with me on a case study, and I'll be talking a little bit about my 2022 year in review and a few goals I have for 2023. One thing I really want to focus on with this channel is actual real life training and filming training sessions, assessments, case studies as they actually happen, unedited, uncut, real training. And I want to do that for two reasons. A, because I want to be able to have people learn from the stuff that I'm doing. And second, I want to also be able to not only put out all my successes, but put out the failures too, so I can learn from my failures in front of the world, because I'm going to have questions about clients and I'm going to run into roadblocks, and it would be awesome if I can use this channel as a way to do case studies where I can put stuff out there, show some of the stuff that I know, and whenever I get stuck or whenever I have a question or whenever I'm failing, to be able to ask a community of people, and everyone can learn from that, myself and everyone that's watching these videos also. So that's kind of what I'm doing here, is I'm just putting it out there, and in hopes that everyone can get some good learning experiences from my day to day. Our first case study is Ian. And Ian is a male in his 40s, early 40s, who is a former trainer and currently works in insurance sales. He has a history of a right shoulder injury in his 20s, and he's done lots of throwing on that shoulder since that injury. He's had low back issues on and off over the last decade, a couple times a year. Usually he'll kind of like throw it out and he'll have acute incidences, or he'll have just kind of like that just recurring low, dull, achy pain in his low back. He's also torn both quads in the past running. He's had an issue with his right ankle, and he feels like he has issues on his whole right side all down the chain. His workout history, he's worked out 4 times a week pretty consistently for the majority of his life, but it's been off and on due to injury. So he'll work out hard, have back pain, shoulder pain, something like that, which kind of put him on the disabled list for a while, lose results, feel better, work out some more, injury, lose results. That's my type of client. His goals are to lift heavy again and regain muscle mass, since he has not been able to work out very hard over the last several years because the injuries have been compounding more and more lately. So he came to me because he feels like he is stuck in a pattern that he can't get out of. He feels like he's stuck in his left side. He feels really crooked, asymmetrical, and he feels like he's been doing a lot of stuff, and he has been doing a lot of stuff to try to get symmetrical or get in good alignment, but nothing that he's done in the past has worked. He knows that I've been in the same situation as him and have had good results, and have had good results with my clients in the same situation. So he's coming to me so he can feel aligned again. So let's go through his FMS and we'll start there, see what we find. So here I'm starting with overhead deep squat. You can see he's got a lot of forward lean on that. So we're going to have him go heels up, and from there, big difference. Actually, at the bottom of that squat, he had some profanities to say because he was kind of blown away how much different it felt when he went heels up. So 2 on the overhead deep squat. After looking at both of his hurdle steps, not beautiful, not horrible. So we went with a 2-2 on his hurdle step. The lunge, not so much. He pulled off some lunges in this sequence of testing, but for the most part, he was having a really tough time getting into the setup position on both sides. So we went ahead and gave him a 1-1 on the lunge. Did a quickie on the shoulder mobility. Basically, if someone is further away than a piece of paper, they're a 1-1. So I gave him the quick check. He was a 1-1 on shoulder mobility. Active straight leg raise. He was symmetrical. 1-1s on that. I gave it a closer look just to make sure, but after close inspection, bilateral 1s. Push up. 3 was a little shaky. I didn't get video of the 2, but he had a clean 2 on the push up. Rotary stability. Struggling to complete the pattern. In order to nail this, you want that arm and leg to be straight over the board and get a clean rep. In order to get a 2, you just got to be able to do a rep. But he definitely struggled on both sides to pull that off. So rotary stability, we're going to go with bilateral 1s. Clearance test, good. Clearance test, good. I usually ask him if that feels good or bad. And almost all the time, when someone is in an extension pattern, they say that feels good. So a quick recap of the FMS was a 2 on the squat. He had a 2s on the hurdle. He had 2 on the push-up. And then everything else was bilateral 1s. Next, I went into a couple of breakouts to look a little bit deeper. The first thing I'm doing is just having him lay on a table on his back and just kind of looking at his posture. I'm looking at I'm trying to look at his rib position, his pelvis position, and his feet. And I'm really looking to see if his rib cage is elevated or flared more on one side than the other specifically. And on this, I mean, it looks like maybe a little bit on the left. Not huge. It's not like this big, giant, massive, slap you in the face left rib flare. But it looks a little bit like he's elevated on the left. Just a touch. And almost not. Like I said, it's not a big one. Looking at shoulder internal rotation. Checking the right. Checking the left. And he had limited on the right. It was limited on the left, but it was much more limited on the right than it was the left. And external rotation was more limited on the left than on the right. Overhead, we have, the way I'm doing this test, man, you could really pick this apart. But overall, The left worse than the right. Here I'm checking hip rotation, supine, and I'm getting real picky with this and looking at it over and over again because I'm kind of questioning where I should go with it. I'm looking at internal hip rotation and it moves freely, but it looks like the majority of it is actually just hip hike. So I'm checking and checking and checking internal, external on this right side while I'm communicating to him that all this internal rotation that we're getting is actually just hip hike. So the hips elevating instead of actually getting true rotation of the femur in the pelvis. So we ended up on the right side with limited internal hip rotation, and we had decent external rotation. On the left, we had limited external rotation. And then when we checked internal rotation, it was a little bit better than his right side, but still not great. Shoulder horizontal abduction, checking on the right. Limited. Left. Much, much better. This is the question. And I'm not good at this test, so I've not been doing this test a lot. I haven't been doing this test a lot, and I've recently started to do this test a lot more because I'm starting to look more into the position of the pelvis and the position of the femurs in the pelvis. Whereas most of the time, I really, over the last couple of years, have not dug too deep into this as far as assessing and reassessing. I put my big focus on getting extremely extended people out of extreme extension and just kind of restoring reciprocal movement. But here I'm trying to do an adduction test to kind of verify some information that I think that the path he's going down, but the results are inconclusive to me because I'm unsure if I'm doing the test right or if I'm missing something. So this is where I need help from people that are familiar with the adduction drop test. You can see that he's limited on the right. What did I do wrong? What? That one? Yeah, maybe I yanked it back into extension too far, but still, like, what? From what I know, he should not pass the adduction test on the left. But there it is, and I don't know why. So if you know why that's happening, could you please chime in the comments and help me? Because I have no idea if I did that test wrong or if there's just something here in the grand scheme of things that I'm not seeing or I don't understand. Because to my knowledge, that left side should not drop. So please help me out. And over here we're doing the Thomas test. On the right, he's good, full extension. And on the left, not as good. And then when I brought him over to the midline, got an even better measurement there. That he's not as good on the left as on the right. So quickly go over these chicken scratch results. Leg raise was a bilateral fail. Shoulder internal rotation, right was worse. Shoulder external rotation, left was worse. Hip rotation, my notes were standard, left AIC. Shoulder abduction, right worse. Adduction, drop test. I wrote bilateral fail because I should have wrote Steve fail. I don't know. And then Thomas test left fail. Also, was not pictured as I went over a couple breaths, just looking at some natural breathing patterns, and he had a tough time exhaling, and he had a slightly wide infrasternal angle. So to summarize that, most of that is pretty typical as far as the FMS is concerned. Nothing big standing out there. The only thing that really stands out to me is with all of those ones that there is no pain. But we do know he does have pain at times. He's just not in acute pain right now. As far as the FMS world is concerned, we're going to start with active straight leg raise and shoulder mobility in that box of the hierarchy, and have our corrective strategy be based around that. When we did some of the PRI influenced breakouts, everything was pretty standard there, and like I said, I'm not good at these tests yet. I've just really been doing it on a regular basis over the last 6 months after a long layoff of dabbling. But everything seemed, from, taking the accuracy of those tests and how my skill level is at doing them into play, everything still seemed pretty standard, except for two things that stand out are the drop test and why, if everything else pointed towards left AIC, well, why would there ever be a left drop test clear unless you have done an intervention strategy that has cleared it? So, like, I don't know why someone would come in straight up off the street and drop on that side besides user error, because I haven't went down that rabbit hole enough. But that is what's cool about this, is I have, since this happened, started down that rabbit hole and trying to find out. If you have anything to comment on that, please let me know. And number two is the leg raises were pretty dead nuts bilateral. I don't know. I would think there might be an asymmetry there, but that's not like this big question in comparison to the drop test. So he says he feels like he's in his left, which stands out. However, I've come across a lot of people that feel like they're in their left. He's also had a pretty long-standing history of having right ankle and this right toe injury and feeling like he has a lot of issues on his right side, which might have him shifting. However, I would still think the underlying pattern is there. So I don't know how any of that equals an adduction drop test on the left. But regardless of the drop test results, my plan of attack is still going to be the same. My goals for him are, number one, break extension tone. So he's super extended, he's locked in extension, he's having a tough time getting into flex positions, and he's having a tough time getting full exhalations. So the first thing we're going to work on is having him exhale into flexion and starting to get a feel for being more comfortable in that exhaled position and how exhalation drives flexion. Number two, I want him to get internal rotation. Bilateral hip internal rotation. There's really specific words that smart people use for all this, but I want his hips and pelvis to both go me. I want him to go from this to this more. I want him to dial it in. I want to be able to exhale into flexion and exhale into internal rotation, and start to feel the insides of his feet and start to feel his adductors and start to feel the ground through the insides of his feet and through that interior chain up into his core, and how the floor connects through his foot into that part of his body, and then start to use those new positions, or not new position, or use good foot stabilization and foot positioning to drive better hip positioning and stabilization, and start to move his upper body on that good lower body positioning and stabilization. And number four, I want to do things to get him in and out of both sides of his hips, pelvis, body, and stabilize both sides correctly, and continue to follow up more on the drop test and how that comes to play in all of that while working on both sides. The four big markers that I'm going to use to know if I'm doing a good job with his program are going to be his active straight leg raise, his shoulder mobility on the FMS, and then his internal shoulder rotation, and also him just straight up telling me how he feels. If as we're going down the path in his training sessions, I'm seeing those tests improving and him giving me feedback saying that he's feeling better in any way, I know we're moving forward correctly. I'll also probably be looking at the adduction drop test and the shoulder horizontal abduction test too, just to check in on things. And those are the tests I'm going to look at often. So I'm going to try to look at those tests on a regular basis to see how they're budging. And then after each block, which is usually 8 weeks, 6 to 8 weeks, I'm going to retest everything and kind of look at the big picture. So that's the assessment. My thoughts on the assessment and the biggest takeaways that I got from this assessment. Next week, I'll go over the exercises that I chose and go over some of the footage of Ian's first training session. Next, I want to do a quick recap of 2022 and some things that I want to do in 2023. So 2022 was a good year for myself physically. So I kind of put a focus on getting back in shape again, and in that, I've done a lot of things that I haven't done in a while, and then some things that I've never done before at all. So, a quick list that I wrote down was I lost 37 pounds. I did a pistol squat for the first time. I've never been able to do a pistol squat on either leg, and I was able this year to do a pistol squat on both legs. Feet together squat. Never been able to squat with my feet and knees together, and now I can do those for the first time. I can keep my knees together when sitting. So pretty much, yeah, anytime I would be in a seated position, my knees were out. If I was to try to put my knees together, it would be like doing a 1 rep max. So I can just easily sit with my knees together for the first time in my life. Also did a cartwheel for the first time this year. Did a tornado roundhouse kick this year, which was pretty cool. I won a Taekwondo tournament, and I ran a 5K for the first time. I've never been able to run. It was just ever. In my entire life since I've been a child, I've never been able to run without extreme lower leg pain. And this year, for the first time, I ran a 5K without pain. So that was a big feat for me also. On a business front, I set up this little room to be able to record stuff. I got a little mic here and a couple lights, and got a new iPad so I can do stuff and edit video. So I got halfway a little professional setup, a quiet place to be able to go in my house to be able to make content, and dusted off some of the old Smart Group training content like this YouTube channel and the website content and products, and have been kind of getting that stuff updated and brought back from the dead. So yeah, it's been a pretty good year, mainly on kind of getting my mojo back. 2023, I got some things I want to focus on as well. On a personal level, I got that I want to swim 6 laps. So I suck at swimming. I've never tried to not suck at swimming. So this year, I want to focus on that. I want to swim well enough to be able to swim 6 laps. I don't remember the last time I've tried to swim 1 lap. I don't remember the last time I've swam a half a lap. I don't swim, so yeah, I want to knock that out this year. The snatch test, I haven't done that for a long time. I haven't attempted that in a long time, and I have no idea if that would be, how difficult that would be. So I want to give that a shot this year and see how that feels. And if it's not easy, I want to be able to do that again. I want to get a new belt in Taekwondo. I want to win a kickboxing event. Never kickboxed. Yeah, so I want to do that this year. I want to do a weight cut, take a sexy photo for my grandkids, and then never cut again. So with the whole back pictures, I don't know if you've seen the video where I got the progress pictures of me losing weight and the pictures of my back. I'm like, man, I got these back progress pictures. I should get ripped and do a weight cut and take a front picture one of these days. And so I always have a picture of how lean I was to show my grandkids whenever I'm like 75 years old. So I want to do that once before I get old and crusty. And also from a business standpoint, I want to finish getting that SGT content updated and make sure that that's available for everyone. I know there's a lot of really good information in those products, and it's just kind of sitting there inaccessible to people, so I want to make sure people have access to that again. Some things need to be updated, like for example, like the rotary stability is different, and like the way I train is different, as far as I don't train as many people now, so I like to add more small group and semi-private stuff into that, into the stuff, and just keep updating it and make sure that it's always good content. I want to get better at shooting videos, editing videos, the editing of the training sessions. Like, I feel like I'm getting better at this part, but I feel like me talking over that video of me training was a travesty, and I need a lot of work there. I want to be able to have really good videos of training sessions eventually, to where it's like a look into my gym and you can see me training, hear me training, get my thoughts on how the training sessions are going, should be going, assessments, the whole 9 yards. I just want to be able to do my job and show you guys what that is, and have people be able to learn from my day at work, and have me be able to continue to learn from everybody else from watching my day at work. I just want to continue learning as a trainer and sharing what I'm learning, sharing the training sessions, and hoping that you guys can get an inside look at what I'm doing and maybe get some sort of value from that. And I just want to make that experience better for you every week in 2023. Thank you so much for watching, and I'll see you next week.